Well, good morning, everyone, and welcome to Health Talk. Here we are again on another great show. I am Dr. Victor Politi. I'm the president and CEO of Nassau University Medical Center over on Hempstead Turnpike, that big 19-story building that you guys drive by every day. We are here today to talk about what's new in healthcare and some of the changes that are going on at the hospital at Nassau University Medical Center, New Health. And there are a lot of changes. Nassau University Medical Center, we're undergoing some major renovations on the inside to all of our units, establishing new intensive care units, $38 million Level 1 trauma center, which is an emergency room that has heliports and an operating room right in the ER, and some of the best specialists available 24 hours a day, 7 days a week with CAT scans and MRI. So, I think we all know that Nassau University Medical Center is there. It's been there since the days of the Meadowbrook Hospital, and it's been providing, excellent care for the residents here of Nassau County and East Meadow. Only lately we've really, started to really go into a whole new level and, basically bringing up the services that are available for a hospital to make it a world-class hospital, to bringing in physicians of great background, great training, with some really great residencies and subspecialties. And one of those physicians is here with us today. And on today's show, we're going to be talking about pediatrics, childhood obesity, wellness for these children, and the different types of health effects that could occur with childhood obesity and other types of illnesses that affect these children. And today, Dr. Jacobson that we have here, Marc Jacobson, is a pediatrician specialist in pediatric endocrinology, particularly dealing with obesity in children. So, Dr. Jacobson, I just want to welcome you this morning to the show. Thank you for coming in this morning to talk to us. And why don't you tell us a little bit about yourself and your background and training and stuff like that?
Thanks for having me.
Sure.
I want to say I'm proud to be a member of the Nassau University Medical Center Pediatric Department. I grew up in the Midwest in Kansas City, and I went to medical school. I went to undergraduate school, medical school, residency training at University of Kansas. I did my fellowship at University of Maryland in Baltimore in adolescent medicine, specializing in nutrition and prevention and atherosclerosis prevention, lipids, and obesity. And I've been at Nassau University Medical Center about 5 years now, and I really enjoy it. I get a chance to see a great population of patients from the local community with really serious illnesses that are preventable. And we have a good team dedicated to preventing childhood obesity and its complications.
That's great, and it's something that we really do see today, especially, or it's becoming more, I guess, visible, is childhood obesity, and it's getting publicity. And it's interesting that you say Kansas City, because that's probably one of the, gastronomically, one of the better cities in the country to go to eat some really good food. And so
I could give you recommendations for barbecue anytime.
Yeah, Kansas City.
Anybody wants to call me, I'll tell you where to go.
Yeah, and they have some pretty good teams out there too. So that's a great
it's been a
great
good-
part of the country.
Good sports year the last couple of years.
Oh yeah, absolutely. So now that you're with us in Nassau, and it affects all demographics, all socioeconomic levels, childhood obesity, and it's kind of a tough. We were raised to eat. I come from an Italian family, and all I did was eat my whole life. And if you weren't eating, your grandmother was, so what's wrong? You're not feeling good, so have some more. And it wasn't like fruits and vegetables. It was meats, it was milks, it was butters, it was creams, it was everything that we're learning today is really, they're trying to kill me. You eat all this stuff and to excess, and God forbid you with thin. What's wrong with Vic? He's thin. Well, actually, I never had that problem, but with some other people, he's not eating. There's something wrong. And now we're saying, and we're realizing. The fallacy to that it's just the opposite. It's what we eat and how we take care of our bodies that are going to give us longevity, that prevent these chronic illnesses as we get older. Because God willing, we're all going to get older, and we're going to get into our, whatever the later years are that we make it to, and all the things we do starting as a child will affect
Yeah.
what we do back, what happens when we get older. So
Yeah.
why don't you tell us a little bit about what the problem is and how we
Sure.
plan on combating this? I mean,
Yeah. Let me just say along the lines of what you just said, we want our patients to die young at a very old age.
die young at a very old age.
We
Hey,
want them to be healthy until the end. They go a long time.
sure.
And what you said, there's a huge shift has occurred in our food and exercise environment over the last couple of generations. And our grandparents were worried about kids starving, but that's not really a significant issue, fortunately, in the United States. The much more likely is that kids are going to become obese. And we've done studies in Nassau County showing in certain areas there are as much as half of the kids in middle school are already overweight or obese. And they have all the complications like high cholesterol, high blood pressure. We're now seeing type 2 diabetes in adolescents. When I trained, probably when you trained, type 2 diabetes was called maturity onset diabetes because you never saw it before age 40 or so. But now we see 15-year-olds with type 2 diabetes. So it's a serious problem. It has tripled in children in the last 25 years in the United States. It used to be 5% of kids were obese by BMI criteria. Now it's up to 15% of kids of all ages are obese.
What age should we really start to be concerned about this? About children being overweight and worrying about cutting back on some of the caloric intakes.
Yeah, we now have good reference curves for kids down to from birth forward, and we're starting to do at Nassau University Medical Center. We have some grants from the American Academy of Pediatrics to do prevention in preschool and younger in infants who are in child care in various settings in Nassau County. So all the way down to birth.
Mm-hmm.
In fact, this is an intergenerational problem. Probably the best we could do is have mothers start getting healthy before they even start their families, because having obesity or diabetes or smoking during pregnancy, these probably transmit some of the problem to the
So a
offspring.
lot of the prenatal care that we give the
prenatal.
mother, so the child is born within a good birth
Yeah.
weight and keeping that. Because
Yeah.
you think about everyone, they're 3 and 4 and they're eating, and you say, oh well, eventually they're going to grow out of that,
Yes.
and they're going to slim down and learn their. But no, we're actually sort of psychologically imprinting into these children at young ages that it's okay to overeat and to eat foods that really aren't healthy for you.
That's right. That's right. Kids are getting soda
Mm-hmm.
inappropriately at a very young age, and juice. Parents think juice somehow is particularly healthy, and that's partly our fault in medicine, as we probably taught that a generation or so ago. But now we realize juice is very sugary, and we feel kids should not be drinking.
I mean, sugar seems to be a culprit here. I mean, it
Yes.
seems to be like the next tobacco. We realized with
Exactly.
cigarettes that we had generations and generations of people smoking, and that the diseases we see today can be prevented by stopping the smoking, or at least
Yeah.
slowed down if we're thinking about strokes and cardiovascular diseases. And now we look at other things such as sugars, and we're realizing that we're overabundance of sugars and candy and sodas and sweet juices really lead to obesity and diabetes.
Yeah. The food supply has changed dramatically in the last 30, 40 years in the United States, and that has a big impact on obesity. The exercise environment has also changed a lot. In 1950, 90% of the trips outside of the house were on foot. And just think about how many times you've left your house on foot in the last week.
Yeah.
No one does it. No one can't. The built environment has changed, so you
I
have to be in a car.
I drive my car around the corner of the bagel store to
Yeah,
get
that-
bagels. So.
Yeah, so it's changed a lot for children. They used to, I'm sure my mom would kick me out of the house, lock the screen door, and say, "Come back at dinner time, get out from under my feet."
Right.
But parents now keep kids in. They're in the house. They're not out running around in the streets
Yeah, it's
for a
true.
variety of
Yeah,
reasons. So
yeah.
they get less physical activity,
Yeah.
and the dietary environment has
Yeah, it's
changed
true.
a
When we
lot.
were kids, it was, get home from school and get out on your bicycle and play with your
Mhm.
friends and do stuff and just
Yeah.
come back for dinner and do your homework. But today, again, for whatever the reasons are, safety concerns, some other issues that
Yeah.
parents are keeping the children in. And the games have changed. No longer is it
Yeah.
stickball and stoop ball and,
Yeah.
punch ball and all those things. Now kids are on that computer and they're sitting in front of that computer for hours and hours on end. And if they're not in front of the computer, they're on their iPhones.
That's right.
And going after Angry Birds and other crazy animals that they're killing on their screen. But
Yeah, and
it's
texting
changed.
their friends,
Texting,
and
yeah.
that kind of thing. Yeah, so it's very different. So parents have a difficult time, and we try to help them with individualized counseling. We try to learn as much as we can about their food and activity habits of the whole family and try to help them gradually change those into a healthier mode. We think it's the best way of preventing and treating obesity.
So a mother be concerned the child is gaining weight or he's not as active as he should be or something's going on, or they come to you because they already have some signs and symptoms of some sort of diseases, hypertension as a
Right.
young child picked up in a screening exam, or high glucose at a screening exam, or some sort of cholesterol or infection, and now they come to you, and you look at the entire spectrum of the family and you try to determine exactly what's behind this. And is that
right.
difficult to change,
Right.
to affect any change in that?
It's it's a challenge. It's definitely a challenge for the parents, and it's a challenge for us and for the children. And we have, we try to use the most modern methods. There are things called motivational interviewing, which has come really from the addictions side of things, the drug addiction and cigarette addiction, alcohol, as a counseling method in which you help people bring forth their own solutions to the problem and then support them in doing that. It's time consuming, but it works a lot better than just saying, well, this is what you should do A, B, and C, and come back and see me and see if it works or not.
And even the environment. I mean, as parents, we're busy. We're running
Yes.
around like crazy. Both parents are working, and sometimes we don't have time to cook dinner. Sometimes we have to eat, fast food. And I'm not picking out any particular fast food because I don't think there's any. They're all equally is problematic. So I mean, you'll eat fast food and then you have to run out to soccer game, and then you have to. Well, your kids are running like crazy with the parents, and some with these families with the two working parents, they have nothing left but fast foods, and so that leads to this.
It does, and it's very challenging. And some of the things, just as an example, I tell families to try to prepare ahead. You know when that soccer game is going to be, and you know what your work schedule is. You know that particular day is going to be difficult. Instead of going to a hamburger restaurant or grabbing a slice of pizza, stop at the grocery store, pick up a roasted chicken. You can cut it up into 4 sections, get a vegetable, and you have a healthy meal. And it's just as fast. You actually save money, and the kid learns to eat healthier. But it takes planning, and people, as you say, are stressed.
And you mentioned
It's
cholesterol,
difficult.
and usually we don't really worry about cholesterol till we're in our 20s and 30s and 40s when we go and our cholesterol's high and we try to modify our diet. But now we're picking up these high cholesterols in younger children
Yes.
because we weren't really concerned about that years ago. We were like, okay, your child has a high cholesterol, but he'll grow out of that.
Yeah.
Is that no longer the case?
No, we now know that the earlier you start lowering cholesterol, the better result you get. We can add, particularly for kids who have genetic abnormalities of cholesterol metabolism, which is one of the most common genetic abnormalities that are seen in children. 1 in 500 kids have familial hypercholesterolemia. So every pediatrician has 4 or 5 of these in his practice. We're now doing universal screening of cholesterol by age 10 for all kids in order to pick those up. And data show that the earlier you start, the more disease-free years you can add to somebody's life. You can make somebody who has a cholesterol of 300 when they're age 8, which is primarily a genetic problem. If they're treated adequately, they can have a normal lifespan.
So
Whereas if you wait until you're 20 or 30,
Right.
you can only improve lifespan by 3, 4, 5 years.
We put them on medication for that?
Yes, we now use statins regularly in younger children who have this genetic problem. Most of the children with hypercholesterolemia, frankly, that I see are related to diet, exercise, and we treat them first with diet and exercise. And most of them we can get into the normal range
Remember
without medication.
an old urban legend from the Vietnam War area where they were doing surgery on autopsies on soldiers that died in battle, 19, 20-year-old soldiers, and they had significant atherosclerotic heart disease in those 19 and 20-year-old soldiers, showing that even back in the 60s that this was a major issue that we really didn't look into too closely.
Right, those early studies, they were actually some in the Korean War as well, showing a 75% blockage in arteries of 20-year-olds who died from wounds in the war, not from heart disease. Really launched the field of pediatric atherosclerosis prevention. Got me interested in the field, and we've learned an enormous amount, obviously, since then. Statin drugs, we have a whole new group of drugs coming out to lower cholesterol called PCKS39 inhibitors that are waiting for these to come onto studies in pediatrics because they're very side effect free and powerful drugs.
The statins are great, even in adults, but a lot of adults can't tolerate the myalgias and the other symptoms that come with those statins. And so, they'll try different classes of statins, they'll try different types of statins, and sometimes there's some cross-react, those side effects affect them over different drugs, and there's really not many other drugs for them to take without, some of the other anti-cholesterol medication have some severe side effects. And so
we are able there are newer drugs, Zetia is one of them, and the phenofibrates are there, and the old standards of bile acid binding resins. Sometimes a combination of a couple of those at lower doses are as effective as a statin. So certainly I run into this from time to time. Parents of my patients who can't take statins, and we're able to help them get a normal cholesterol even without that. Of course, you always have to fall back on diet and exercise even with the statin. It helps.
Of course. And that's a big part of being a physician, no matter if it's pediatric endocrinology, emergency med, is always prevention. And we're always trying to get people to live a healthier life. Whether it's, something as simple as putting on your seatbelt or wearing a helmet when you ride your bicycle or, other things that are sort of, think of as run-of-the-mill medicine, but really mean a lot in preventing diseases, to the effect of, diet and modification and alcohol consumption and, just exercise, things like that really will add years to your life and give you a better quality of life. As you get older, and obviously starting at a younger age and making that part of your daily routine, and that is your normal, your normal meals, your normal type of stuff. Hey, so everybody can have a soda every once in a while, but you shouldn't be having a soda, every day with every meal.
That's exactly right.
Yep.
And this prevention, I've seen it become more over my career to become. Much more emphasized, and I think we'll see more and more of that. The Affordable Care Act is going to, I see it moving that way, that more of healthcare will be on the individual.
Do you see the school system and the schools getting more involved in medicine, getting more involved in children's health than they were in the past?
I think there is some of that. There needs to be more. There's plenty that the schools could do. I see on Long Island, particularly private schools that don't meet their diets don't meet the USDA guidelines, could do a lot better in what they feed the students. Physical activity, although the New York State law requires daily physical activity, most very, very, very few schools actually comply with that law for a variety of reasons, because we don't test for physical fitness, and we don't support physical activity financially in the school as well.
Yeah, and
So
it's
there's
true.
more they could do.
The food in the schools are getting healthier. So I
That's
can only
right.
just imagine or remember the stuff I ate in high school back in the day.
Yeah.
But today they're getting fruits and vegetables, and they're not eating as many, fried. Everything back then was fried.
Yeah.
If you whatever they cooked, it was fried, and they're trying to stay away from the fried foods and the fatty foods, and that's important. I know even in the hospital. In our dietary department, I talked to the head dietitian as a CEO, and I said, "Well, why don't we get one of these donut things?" And he said, "Absolutely not. We're not going to have that in my hospital. I serve only healthy food, and to the residents and to the doctors and all." And I respect that. So because we're thinking again one of those kiosks with the donuts and the coffee, and she says, "Nope, I'm not going to serve that here. You're going to have fruit and." And so now I got to sneak outside to get a donut.
Get your donuts, right.
My fix. But it's important that's
We
that.
are trying hard,
Yeah.
and the dietary department at NUMC is advanced and doing a really good job.
Yeah, and so do we see a lot of juvenile onset or adult onset? I'm sorry, diabetes in teenagers and young adults now. Is that what you're seeing?
Type 2 diabetes, yes, is becoming, it's a third of new cases of diabetes in childhood are now adult onset type 2 diabetes rather than type 1, whereas decades ago that would have been zero.
And what would key a parent into the fact that the child is type 2 diabetic? Is there some, the child's sleepy? Are there any issues that could sort of, trigger the parent to go to the physician to get checked up, to the pediatrician?
One of the most common physical signs is a darkening and thickening of the skin around the neck. Parents sometimes think it's dirt under the collar and try to scrub it off. That's what it looks like. It's called acanthosis nigricans, and we see it very commonly. It's actually a pre-diabetic condition, and often it triggers the pediatrician to refer patients to the hospital for evaluation. So the other things are the BMI. I think every parent should know their child's BMI and what percentile it is, and unlike your child's grades, the higher is not better. You want a lower BMI percentile. Under 85th percentile is considered healthy. 85th to 95th is considered overweight, and 95th and above is considered obese. And we see many patients who are way above the 95th percentile, even into the 99th percentile.
So you mentioned BMI, body mass index. Now someone can get that online, just Google BMI and come up with a
Yes.
chart.
Yes, you can do it from the CDC website, cdc.gov, and put BMI in there, and that'll give you a percentile for your child, or even better, ask your pediatrician what it is, because they're measuring it, and when you hear it, you'll get a little counseling as well. It can be shocking. I've seen parents and patients in tears when they see that their child is, quote, obese. It's a very emotionally charged word, so I try never to use it directly with the patient. I say you have a weight issue, or your weight is growing faster than your height.
Well, one way
It's important to have some counseling available sometimes when you find out this number.
one way to hide that growing up, I remember, is we never were obese. We were husky.
Yeah,
You couldn't wear like regular jeans. You had to go to the husky area, which is a nice way of saying lose some weight.
Right.
That was a little, so, but it's important that the parents recognize the signs and symptoms, that they go get, especially the BMI, which most of the scales that people have in their houses are really not calibrated very well. They really, it's the physicians, the pediatrician's office, they'll put them on one of these really calibrated scales and get an accurate BMI, and be able to, I guess, work together with the parents, caregivers, to come up with a program for the child to do have some weight loss and not really feel it.
Or even just not gaining, but growing into their weight. One advantage that children have over adults is when we find out we have a problem, we have to lose weight. They can often just hold their weight or reduce the rate of growth of weight while their height catches up, so to speak, and they become thinner.
Yeah, that's important. Right? We want to make sure that we keep an eye on these kids as they get older. So, I mean, basically, some advice for the families. What should we really be doing right now? We have a child. The child looks healthy. He's active in sports. He's running around. Should we watch what he eats? What advice would you give the listeners right now with their children?
Sure. First thing is to know their child's BMI percentile. So that's speak to your pediatrician. The second thing that's really important, we call it 5210. 5 stands for 5 servings of fruits and vegetables a day. If children were eating more fruits and vegetables, they would be eating less of those things that would get them into trouble. 2 stands for 2 hours or less of screen time, TV, Facebook, video games, etc. So 2 hours or less of that per day. 1 stands for 1 hour of physical activity. That's just anything that you don't do sitting down. Doesn't matter, whatever the child enjoys, riding a bike, walking, kicking a ball around, chasing their pet or their brother or whatever they want to do. Even cutting out paper dolls in some ways is better than watching a screen. So 5, 2, 1, and 0 is 0 sugar-sweetened beverages, which is juice, soda, sweetened teas per day. Or those should be a treat, nearly 0 of those. And if you stick to those 5, 2, 1, that's a very good preventive technique, and we also use it in early treatment of obesity.
What about these sugar substitutes that we see in the sodas, the diet sodas and the saccharins and those types of things? Is there any benefit or harm to using? I know there's some recent literature out there.
My approach to those is that they should be rarely used, but there's times when there's just no, you just have to have a soda sometime. And if your child's already overweight or obese, then I think it's better than a regular soda. It may not. The best drinks for kids are water and skim milk. But if you're having something else, diet is a little bit less bad than a regular soda. And my approach is to mix them up, not always use the same one. There are many different types, so that your exposure is to any one particular one is decreased. We have no evidence of direct harm from non-nutritive sweeteners, but we don't have really good safety data long-term either. And I think just caution tells you shouldn't be using a lot. And what I think you're referring to is there's some new data showing that diet soda may be related to onset of obesity and diabetes.
Yeah, it basically triggers the pancreas or fools the pancreas into thinking it's having sweets, and it's still using the insulin when it really wasn't necessary.
That's
so might
right.
do something. So I mean, this is really a lot of things going on in pediatrics in general. Pediatric obesity is a problem, particularly in the inner cities and in Nassau County. We have a very big proportion of our children that are obese. You've mentioned many different ways that we can try to correct that and fix it, and keeping kids active and eating healthy, and a lot of it comes down to us as parents, what we have in that house when they open up that snack drawer and what they see in there. Is it a bag of candy, or is it a nice bag of grapes?
Yeah.
But you'll see how
That's
quick
right.
the kids will be over their friend's house that have the parent with their bag of candy. Nobody they hang out at your house no more to eat the grapes. But it's really a great thing, and to have you as part of NUMC, Doc, to have a service like yours, with your knowledge base and your specialty available to the children of Nassau County, it's really great. And I can't thank you enough for being part of the hospital. It makes me really feel that I'm part of a really great facility. I don't think the people in Nassau County realize what Nassau University Medical Center has. Sure, they all know, well, God forbid I get into a car accident, that's the place I want to go, or a shot or some crazy thing. That's where I want to go. My hand gets cut with a saw. I mean, they have the Long Island Plastic Surgical Group in there, the plastic surgeons. They have some of the best orthopedic doctors. They have the greatest operating rooms. for our trauma center, but they don't realize all the other services, the pediatric services, the actual, you don't know where to go with your kid. You're going to go to a doc in the box or these urgent care centers, and they're great for, whatever they need to do. But when you need a guy like you, a doctor that specializes in some things, National University Medical Center has all those subspecialties. And, we have a phone number, 516-486-6862. Again, I'll read it again. That's the National University Medical Center, 516 area code 486-6862. And you can call that number, just one number, and you say, listen, my name is Vic, and I want to make an appointment with the pediatric endocrinologist or the pediatric obesity doctor, and they'll arrange an appointment to come see the doc. And, it's amazing.
I have appointments open next Monday. If
Next
anyone
Monday?
wants to come.
And it's the fact that you're sitting here and the knowledge base and that this service is available. It's just really a great thing for the people in Nassau and for us. So I want to thank you for being here, Doctor. And again, I want to thank everyone for listening today here at Health Talk, which is our National University Medical Center on Hempstead Turnpike there in East Meadow. We're your hospital. We're here for you. And I want to thank you again for listening, and have a great, healthy day. And we'll see you next time. Again, Dr. Victor Politi. Bye.